Jonathan Peterson was diagnosed with stage 1 bladder cancer just 2 months before COVID-19 exploded across the world. And by January, when the first cases were recorded in Canada, the 45-year-old was left with an entire new layer of stress.
You don't have the support because everybody's so far apart, everybody's staying away from each other, which is good. But it's just a further isolation of the whole process.
Forced to attend appointments without the support of his wife, completely locked down in his home, and fearing for the future of his surgical schedule.
You're like, wow, I'm lucky I'm getting my treatment today, but then you're like, how much longer is this going to continue?
In April, Peterson's hometown of North Bay opened up its hospitals to be used for ICU overflow, and his 5th surgery was canceled.
Which obviously freaked me out because, again, with the cancer in the bladder, it could come back at any point.
According to the latest research by the Canadian Institute for Health Information, overall surgery numbers between March and June of 2020 were down 47% compared to 2019. Ferg Devens, survivor and chair of Bladder Cancer Canada, says now more than ever, patients need to advocate for themselves.
Forget that it's COVID times. Forget that you might be hesitant. If you see blood even just once in your urine, please see your doctor.
Last week, after a month-long hiatus, Ontario hospitals were given the green light to resume non-urgent surgeries. Still, experts expect it to be busy in coming years. The province's fiscal watchdog estimates hospitals will have to operate at 11% above pre-pandemic levels to clear the backlog, which could take more than 3 years.
You want your stuff done immediately, kind of yesterday. So it's just kind of taking it one day at a time.
Peterson hopes to go back under the knife again in June, determined to beat his diagnosis, pandemic or not. Jamie Mauracher, Global News, Toronto.